But first, and new at 5, we're investigating claims of mismanagement at a medical office in Shingletown. Former employees and a patient brought us their varying concerns about care and working conditions at Shingletown Medical Center. Action News Now reporter Blake Mayfield took these claims to the facility's CEO.
It didn't get diagnosed until I think early November. And it could have been diagnosed in April if somebody had just touched me.
Jeannie Curry is speaking out after she says the Shingletown Medical Center delayed care for her lymph nodes for months, only for her to find out 7 months later that she had lymphoma.
It's getting to be more painful every day because it's in my neck and down in my shoulder.
Curry is just one of a few people who've emailed Action News Now recently concerning the medical practices at the Shingletown Medical Center. Curry says her concerns about care, referrals not getting sent, and paperwork being lost were all ignored by the staff.
She told me that if I wasn't happy with the service, I could just go.
When I started working there, I filled out all the paperwork for myself and my children and my husband. My paperwork was lost 3 times.
Quita Gentry is a former employee at the Shingletown Medical Center. Gentry says she only worked there for 3 weeks in July of 2022. She says she resigned out of fear of losing her license due to what she called the facility's illegal practices.
I said, so you had no formal training of how to draw blood? And they said, no, we don't need it. We can do what we want because nobody's going to say anything to us because nobody comes up here.
Gentry says she resigned after finding out her position was not full-time and that the office did not have a medicine coordinator program. Gentry says that while she did not see expired vaccines be administered, she did say that HIPAA laws were constantly violated.
I watched her take the child's referral and put it at the bottom of a stack of easily 300 referrals and say, F this B. I can't stand her. I'm not doing her referral.
But that wasn't all. Another former employee at the facility, who wanted to remain anonymous, told us in an email she saw expired COVID vaccines be given to patients. She says she reported this to the California Board of Nursing, but does not believe they did a thorough investigation. Gentry tells me she never saw anyone administer an expired vaccine, but Curry says she did observe a pretty suspicious sounding exchange.
Something crazy like, oh, we got extensions for that vaccine. And when the nurse said, well, where are they? Because I'm not injecting it unless I see them. They're like, oh, they're on my desk. Well, could you go get them? Okay, just ask another nurse to inject this expired vaccine, which she wouldn't do.
I took their concerns up the hill here to the Shingletown Medical Center, where the office's CEO tells me they're just allegations. Shingletown Medical Center CEO Tammy Frazier told me off camera that there is no truth to Gentry and Curry's claims about expired vaccines, adding that the facility would be closed if the rumors were true. In a statement, Frazier said that the California Board of Nursing found no deficiencies in the medical center's batch of COVID-19 vaccines. But the anonymous former employee says if that were the case, Curry would not have her story to tell.
I hope the CEO and her 2 managers get fired. I keep hearing that, oh, we can't get qualified people. Then shut the clinic down.
Everybody needs to be fired, and they need to just hire a whole new crew of people to come up that cares about this facility.
Reporting in Shingletown, I'm Blake Mayfield, Action News Now.
We also checked the California Board of Nursing's website, and they publicly report that they revoked the license of a former nurse at the Shingletown facility in February. One of the reasons was due to not restoring a vaccine properly and falsifying records that she administered vaccines at the facility when she did not.